Hi guys, today we're gonna do the book review for science communication, especially for chapter 3, and our topic is challenges in communicating sensitive health topics in Africa, and we are group 3. Next page. Our group members have Wang RUIXIN, it's me, and Wang Han, Jiang ZENGHAO, Liu Zhixi. Next pages. So Today we're going to talk about the issues first, and next we will present the importance of science communications in addressing these issues in Africa. And we also talk about the challenges during science communication process. Also, we pick up the 2 cases for our case study. Later, we will give the future direction for improvement, and the last one will be the conclusion. Next page, please. So as we dive into the challenges of communicating sensitive health topic in Africa, it's essential to understand why these issues are so serious. Health challenges such as female genital mutilations, gender-based violence, HIV, reproductive health, and malaria infectious diseases like Ebola and more and like COVID-19 pose a significant threat to public health, especially in communities where healthcare access and education are limited. Next page, please. So also science communication exists different stages of the outbreak of any diseases. As you can see in our slides, pre-outbreak we need science communication to detection and early alert, preventive measures, public guidance. During the outbreak, we need to give the public awareness and launch announcement, investigation, research, and response and containment. Like we need to report daily cases and so on. And last one is vaccination and the treatment rollout. Post-outbreak, we need science communication to evolution, education, and lessons learned. So science communication prevention and awareness to response and recovery ensures that communities are well informed, prepared, and resilient in face of health crisis like that. So that we have to focus more on science communication during this issue solving process. So next, my friend will present the importance of science communication.
Okay, now I want to talk about the importance of science communication for health in Africa. Science communication plays a very important role in providing public health. It not only provides people's health awareness, but also help eliminate the mistake brought by traditional culture and support specific public health policies. Okay, next page, please. It also enables healthcare workers to address health issues more effectively, which help improve overall health in Africa. Effective science communication is a bridge between science, policy, and the public, and it plays an important role in today's societies. Okay, next page.
So I will continue to present the challenges during science communication process. Next page, please. The first part is cultural barriers. So as you can see the data, according to the UNICEF, over 200 million women and girls worldwide have undergone FGM, that is female genital mutilations, as we mentioned before, with a majority of cases in 30 African countries. In some countries like Somalia and also Guinea and another countries, FGM rates are over 90%. So, but besides the belief and the social norms, FGM is supported and enforced by influential members of society, such as community elders, religious leaders, or even older women who have undergone the procedure. Science communication must carefully approach these topics to avoid offending local customers. So, for many girls and families, not participating in FGM can lead to social ostracism. Have you ever seen the movie called The Desert Flowers? The poster is on the top right of this slide. So if you haven't seen these movies, we recommended to you to review these movies to know about the issues about the FGM. Next pages. The second part we want to talk about is stigma and misinformation. Stigmatization of health issues like HIV or mental health lead to the silence, fear of judgment, and limited willingness to seek help. And also misinformation often spread through social media or word of mouth. So this all can be due to the traditional concept or stereotypes and misinformation also from the multimedias and fake news. And they all they all will lead to the bluff and the fear of judgment. And all of this also can lead to the few misses, causes, treatment, or preventive measures. That's all of the results. Next part. So third, government policy is another factor that affected the scientists' dissemination of health issue in Africa. So even with the rapid development of the internet today, information is still controlled by the government in most cases. And the speed or effect of its dissemination depends on the current need of government officials. At the same time, due to the long-term inaction of government departments, the public's trust in government has decreased. Next page. So the first aspect is acceptance of the health knowledge among African people is also a challenge faced by science communication in Africa. For example, geographical restrictions and the gap between rich and poor, and the education level, culture and religion, and so on, all affect the acceptance of scientific health knowledge by African people. The fifth, next page, please. So next challenge is about gap between the researcher and end users, that is, we call the public. There are communication barriers between them. Sometimes researchers use complex language which is hard to be understood, and the researchers prioritize academic rigor and publication, while end users seek practical solution to immediate health issue. Also, there are a lot of tribes in Africa, as we know, so as well as they have a lot of language, that is also a problem for us. The last one is, next page, please. Next, the last one is lack of the resources and policy is also a serious question. Limited funding and inadequate policies will hamper sharing sensitive health information widely. So that is also be an issue. Next.
All right, thank you so much. So here we can see it's about the case studies. We found two case studies, and those examples use different methods to help people better understand and accept health information. Here are two examples. The first one is Kenya's Global Village Clinic. This project shares information about HIV through interactive education, radio dramas, and community meetings in remote areas. Its goal is to help people in these areas understand how to prevent and treat these diseases by using messages that fit their cultures. Next page, please. The second one is Kenya's alternative rite of passage. In tribes like female genital mutilation is a common tradition. Some organizations such as Morph Health Africa have already created the project, offering communities a way to celebrate coming of age without cutting. Those groups use science to explain the health risks of cutting and try to change it. Next page, please. So we have mentioned 6 challenges previously. Now we have definitely some improvements. The first one is use local languages and respected community leaders to communicate health messages effectively. We need to adopt a softer way rather than a violent way. We are supposed to, respect local customers and cultures with respecting silence. The second one is cooperate with local influencers to promote accurate health information. It's a way to enhance credibility. Local influencers are often trusted figures with their communities. Next one, please. Once more, the government should separate understandable information about vaccines, while by engaging these leaders can establish trust within the community, making people more likely to accept and participate in health programs. Next page, please. Furthermore, make the health data cleaner and easier for them to understand. Last but not least, implementing community health programs in rural areas with the support of local volunteers and working with NGOs. It can reduce the sense of distance. Next page, please. All right, in conclusion, we choose challenges in community sensitive health topics in Africa to be our topic, and we analyze it from different aspects like its challenges, improvements, and also the examples are provided. So guys, all in all, changing is not easy, but things are gonna be better and better. I think that's pretty much about our presentation. Thank you so much.